And now today we turn our attention to Ontario's registered practical nurses who are bringing their messages of concern to elected officials here in the region of Waterloo. It's a full day being spent at a Waterloo hotel where local nurses are getting the chance to share their story, and the association gets an audience with some locally elected officials. Not lost on me that none of those locally elected officials are members of the Conservative Party, but that's, I think, a sidebar to the story of really what the conditions are like today and what our frontline healthcare professionals in this province are asking for. Dianne Martin is the CEO of the Registered Practical Nurses Association of Ontario. She makes time for the program. And Dianne, as we get started, maybe you could just start by telling us what it is that brings you to Waterloo today.
Well, we're here in Kitchener today because we know that nursing is facing some very difficult situations, and that the most important thing we could do is give nurses a voice, any nurse. And so we organized a series of town halls across the province where RPNs can share those challenges that they face, what a day at work is like, but also the solutions that are out there. Nurses have lots of good ideas, and we'd like to hear those ideas from nurses' voices directly to politicians whenever possible. And we will have some politicians there with us today.
I'll come back to those potential solutions in a moment, but when it comes to a day in the life, Dianne, I think we got a little glimpse of that in a recent survey that suggested more than 40% of healthcare workers are dreading going into work. What do these results from this survey tell you?
The results of this survey make it really clear to me that things have changed significantly in nursing. I've been a nurse for 45 years this year, and I worked as a labor and delivery nurse. I can't really recall ever waking up, maybe Christmas mornings, but waking up in the morning and not wanting to go into work. My friends were there. There was joy there. I loved what I did. And things have changed so significantly that many of the days that nurses face, they know that they will be short-staffed. They know that they will be asked to provide care to far more people than is reasonable. They know that they will make decisions throughout the day of which care to provide and what is the least important parts of their care so that they can make sure that everybody gets at least the minimum. That's very, very hard on a nurse who, first of all, is educated to provide excellent care, but also has to uphold the standards of the profession.
How did we get here? Is it reduction in funding? I mean, how did we end up with this significant a change?
So I don't think that it's necessarily a reduction in funding, but we've, first of all, always known there was going to be a nursing shortage at this period of time. With our aging population, the requirement for care was always going to be significantly higher in this period of time. And then, to be fair to everyone, we had a perfect storm of hitting the nursing shortage that was predicted at the same time that the pandemic started. And so many more people were sick. So much sicker, and in a lot of places that normally you don't see people that sick, long-term care homes, et cetera, requiring so much more procedural isolation and all of the things that take up so much more time to keep people as healthy as they can be through the process. And so when you look at all of it together, we also had Bill 124 that ended nurses' ability at that time to negotiate a fair wage. It was all it broke nurses, to be really honest with you. It broke nurses, what they faced every day.
What can we do about where we are at? Do we need more resources into the healthcare system? Do we need a reallocation of existing resources? What kinds of solutions can we be looking at?
Well, it's interesting you say about the reallocation, because today we're here in Waterloo and we're going to be meeting with over 30 nurses, and they are going to where to reallocate. So they've got great ideas. But we were always going to need to invest more at this period of time in healthcare. That's basically worldwide, but across Canada, we were always going to have to invest more. So it's not so much any sort of decreases in funding, but it is investing more. And once you create that culture of distress, moral distress among your nurses, you're also going to have to invest in helping nurses return to a profession they love. You know, when I started nursing, everybody entered nursing for life. My mom was a nurse. I'm a nurse. My daughter's a nurse. And everyone it was the profession you were going to stay in for your life, and we don't hear that from nurses anymore. So what we think we need to do, we have to first and foremost legislate manageable workloads. And that means establish nurse-to-patient ratios in law that you need to adhere to, so that nurses know that when they go to work, this is going to be a rewarding day where I can meet the needs of the people that I care about so much. We have to prioritize retention with growth opportunities. So we have to make sure that this is a profession where there is ability to grow, advance, those sorts of opportunities. And the government is helping us with the funding for those sorts of things right now, but we need to expand that. We have to make sure that there's professional compensation across all sectors. So nurses working in one place might make substantially less than a nurse, say, working in another. And we have to make sure that that's level. And finally, we have to guard against cost inefficiencies and privatizing healthcare, which we know costs incredibly more than a public healthcare system, particularly when we have shortages where we start using nursing agencies, where nurses might be making up to triple the amount to work for an agency rather than the actual employer.
You know, Dianne, we had a conversation on our show just yesterday with a gentleman who had experienced a rather traumatic wait time with his father-in-law in the hospital and in need of care. We already referenced, you and me this morning, this survey that suggests 41% of Ontario's hospital staff say they dread going to work and 43% are considering a new career path. How do we maintain public confidence in a system where there seem to be so many challenges?
I think first and foremost, we have to establish the right number of staff once again, because when you hear of a wait time, they're waiting for someone, not for something, but for someone. If they're waiting for example, offloading from an ambulance, they're waiting for staff to be ready. So we still have days where the stars line up and everybody, you have a fully staffed unit and it runs beautifully. But those days are so few and far between now that I understand the wait times in many areas, whether you're an inpatient waiting for something that you desperately need, or whether you are in a merge. So, I mean, I obviously feel very bad for that gentleman, but we need, this is years, we're at the years mark now that this has been going on, and we're committed to working with the government to find those solutions. But I think first and foremost, it's a staffing issue. And it's also a capacity issue, because like I said earlier, there is an aging population that always will need more care. So capacity is important.
What message do you want our MPPs, Catherine Fife, Mike Schreiner, Ashlyn Clancy, I know will be in attendance today. What message do you want them to take away?
I think first and foremost, what they will take away is they will notice that those nurses love their patients. And when they talk about being broken, it's not because they don't get lunch breaks or 12 hours without a break anymore. It's because they are not meeting the needs of the people that they want so desperately to care for appropriately. So I think the first thing they'll note is that this is a really good group of people whose hearts are broken. Secondly, I think they'll note that the issues are specific and they are real and they are across many, many employers and sectors of healthcare, and that it's going to take